Discrimination in hospital remains reality for many people who use substances. Instead of feeling safe, they often feel judged.
No, I don't care. I feel like I'm being judged, or I don't feel like I belong there. So it's harder for me to ask for help.
But how can harm reduction help challenge that stigma and create a safer, more inclusive environment? Good evening, and thank you for joining. I'm Marian Smith, and tonight we turn our focus to one of the most pressing health issues in our community: substance use, stigma, and the strategies that helping save lives.
Maria Perea reporting from downtown Eastside, where the opioid crisis continues to impact countless lives. Tonight, we look at the human side of the crisis and why compassion and support are urgently needed. Thank you for being here and sharing your story with us. Can you tell me a bit about yourself and your experience with opioids?
I've been using opiate for about 6 years now. I started with painkiller when I had my injury. And then after that, over time, I became dependent. I've been in the hospital for a few times, mostly infection or when I have very bad thing happen.
So what has your experience been like receiving care in the hospital?
It depends upon the staff. Some nurses are very kind and understanding, but others don't. No, they don't care. I feel like I'm being judged, or I don't feel like I belong there. So it's harder for me to ask for help.
What kind of support do you wish you had during those visits?
I wish there were safer places in the hospital that I don't feel like I had to hide. Just like harm reduction. Is someone supervised use or just to give us active supplies? Like this one, naloxone, can help people like me to stay alive.
There are two different types of naloxone kits. There's an injection as well as a nasal spray. With the nasal spray, you would tilt the individual's head backwards, you would put the device up into their nostril and then give one firm spray, and then the entire naloxone is going to enter their system. With the injection kit, you have a syringe and needle, and as well as your vial of naloxone. To prepare your injection naloxone, you would then take your needle and your syringe, you would pull the plunger up so that your syringe is filled with air, and then you would then put that into your vial of naloxone. You would push the plunger down of the syringe so that all the air escapes into the vial, and then you would then suck up the naloxone into your syringe. Once your syringe is prepared, you would then go to inject it into the individual that is apparently overdosed. You would pick a fatty, meaty area of their body, whether it be the side of their arm or the side of their thigh. You would just plunge it into their skin. The needle can go through clothing, and then you would give that entire dose of a naloxone at once. Naloxone works because it reverses the effects of the opioid in your system. If you're not sure which substance the individual has taken, naloxone can't do any harm. It can only save lives if it does end up being an opioid-related overdose. Naloxone kits are available in your community, and with a little information and a kit on hand, you too can help save a life.
So what would you like healthcare workers, especially LPNs, to know?
That we are human. We're not just an addict. We're people. Some of us would like to ask for help, but we are scared. Compassion goes a long way. Just simply asking, "Are you okay?" Instead of misjudging us. It makes a difference, Marie. I also wishing that nurses talk to me like a human being, not just someone with addiction.
Well, thank you so much for sharing. Your voice is very important to us.
You're welcome. I hope it will help someone else.
As hospitals begin to embrace harm reduction, one strategy stands out. This is supervised consumption services. They may sound controversial to some, but for those in frontline, they are essential. To help us understand how this works in practice, we turn now to Nurse Benny, who's been part of implementing these services in acute care.
So one of the most effective harm reduction strategies in acute care is supervised consumption services. These are designated medically supervised areas within or near hospital where patient can use substance safely. Instead of using in a hospital washroom alone, patients are monitored by trained professionals who provide sterile supplies, prevent overdoses, offer wound care, or refer the patient to treatment program when they're ready. So what is supervised consumption services are about? Meeting people where they are at, keeping them alive, and building trust. So this strategy is useful because it works. The evidence is clear. These services saves lives. They reduce overdose death, lower the spread of infection like HIV and hepatitis C, and also increase the referral to treatment. And the second is, these services work well inside acute care because they reduce secretive high-risk use. Patients feel safer and more supported. And finally, it shifts care from punishment to compassion. It's not about enabling drug use, it's about supporting human dignity and creating pathways to recovery. As an LPN in harm reduction, we provide overdose response, wound care, safer use education, naloxone kits and training, and patient advocacy with compassion. But most of all, we create safe space. A patient may not remember what medication they received, but they remember if they were treated like a person.
Licensed practical nurses are frontline caregivers. In supervised consumption services, their role is very crucial as LPNs. They monitor patients for sign of overdose, provide basic wound and hygiene care, use non-judgmental trauma-informed communication, offer naloxone education, and build trust with patients who may feel forgotten by the system. Importantly, LPN serves as advocates, ensuring patients are treated with respect regardless of their history. They create a safe, inclusive space inside what can feel often like a cold clinical system.
We purchased this building and built the building around the safe consumption site. We wanted the space to be really comfortable. It is a pretty clinical space overall. We have, the 6 booths in the smoking room, and there's, steel so that it's easily sanitized and cleaned down. But, we wanted the art and the murals on the wall.
I was using opioids, that's downers, Dilaudid, at the safe injection site. It's a good place. They have paramedic that helps people. I like it lots, Prairie Harm. It feels like home when I'm there because everybody gets along and we all work upon each other to help each other because we know how it is being on the streets. Yeah, Prairie Harm's a good place. I like it.
Many of these individuals end up in acute care units due to complications such as collapsed veins, sepsis, or mental health crisis. But the challenges start long before they enter the hospital. Factors like poverty, homelessness, stigma, limited access to care, and mental health struggles all make them especially vulnerable. Stigma in healthcare settings can lead to patients using substances in secret while hospitalized, putting them at greater risk. This is where harm reduction becomes essential. Maria Perea, BCC News, Vancouver.